CIHI Home and Continuing Care Reporting Systems, bringing evidence to support your decisions.
This one tool does so much, and it has improved the care in my facility. I'm sure it would improve everybody's, and that's what we're all here for. I'm a caregiver first and foremost, and I wouldn't do anything unless it would improve care.
I think that what it's done the most is it's provided us with a common language, and people have a confidence that the language is common.
When we're talking to other government departments, when we're talking to physicians, eyebrows raise. It's like, oh, wow, you're getting that type of information, and that database decision making carries a lot of weight with a lot of people.
Home care and facility-based continuing care services are growing rapidly in Canada and around the world. These community-based services can relieve pressure on hospitals and provide care closer to home and family. As Canada's population ages, information on the nature and quality of these services will be more important than ever. Who needs this information? Clinicians need it to deliver the best possible care. Managers need it to run effective organizations. Policymakers need it for overall system planning and funding. The Canadian Institute for Health Information, or CIHI, developed 2 reporting systems to meet these emerging needs for the community sector. The Continuing Care Reporting System provides information on people in continuing care hospitals and residential care facilities, such as long-term care or nursing homes. And the Home Care Reporting System provides information on people receiving services through publicly funded home care programs. Standardized assessments are at the heart of CIHI's Home and Continuing Care Reporting Systems. These assessment instruments are developed by interRAI, a not-for-profit network of researchers and clinicians in more than 30 countries around the world. CIHI maintains a close working relationship with interRAI.
The interRAI and CIHI collaboration, I think, is actually quite unique in the world, in the sense that I think we've gotten the model right about how to implement instruments on a large-scale basis, on a national scale. So what I see as interesting about the relationship is that interRAI really are the scientists behind the development of these instruments and their application. And we can work collaboratively with CIHI to be the knowledge brokers, the people who translate the science that we do into ongoing use on a large-scale basis.
The interRAI instruments are completed electronically as part of the normal assessment and care planning process. These assessments use standard measures that allow professionals to speak a common language across organizations, jurisdictions, and care settings. When assessments are completed, clinicians receive real-time feedback on a person's health risks, potential for improvement, and progress toward their goals. Information from the assessments is also used at organization and system levels to drive quality and plan for resources. CIHI is there to support your organization through every phase of implementing the assessments and the reporting systems. We provide clinical and technical manuals along with hands-on support. We offer instructor-led and web-based courses on how to make the most of the information. We also provide refresher courses to help you cope with staff turnover and build on your team's knowledge base. Your data makes a difference. When you submit to CIHI, you get special access to reports that compare your organization's population and performance with others across Canada. CIHI also summarizes the data for public reporting. Analytical reports shed light on important issues in home and continuing care. And quick stats tables provide key clinical and administrative statistics across provinces and territories.
The ability to compare between jurisdictions within Canada, internationally, that's where there's the real benefit of starting to learn from each other.
They recognize that what the assessment can do for the individual client, that's pretty easy to do, and that's very important. But when they can see what it can do for their planning, particularly in this time when dollars are limited for everybody, and they can say, you know what, we can make a good decision here on what we need to spend the money on and what we don't need to spend the money on right now.
CIHI's home and continuing care reporting systems and interRAI assessments support your clinical, management, and policy decisions. Please contact us to find out more about the benefits of participating.